My name is Prisney Gilly, and this presentation will provide nurses with information about Crohn's disease. Crohn's disease causes inflammation of the gastrointestinal tract, making it an inflammatory bowel disease. The inflammation associated with Crohn's disease is related to an abnormal immune response. The objective of this presentation is to examine Crohn's disease taking into consideration the impact on U.S. population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatments, and nursing evidence-based practice. Beginning with the United States population, it is estimated that about 1 million people are living with Crohn's disease. For unknown reasons, Crohn's is more prevalent in the United States than other parts of this world. A person is more likely to develop Crohn's disease when they are in their 20s, between 20 to 29 years old. It is also more common for people with a family history of inflammatory bowel disease, especially if it is a close relative, such as a parent or a sibling. Jewish people are at a higher risk for developing Crohn's. And lastly, cigarette smokers are also at an increased risk. The exact cause of Crohn's disease is unknown. Researchers suggest that immunity may play a role, more specifically autoimmunity, meaning the patient's own immune system is attacking the gastrointestinal tract. There is some evidence that genetics may also be involved with this disease. Although external factors such as stress and food can exacerbate symptoms, they do not cause the disease. The risk of developing Crohn's is increased in patients with a family history of Crohn's, especially if it is a sibling or a parent. The risk for Crohn's is doubled in patients that are smokers. And there's a small risk with patients that take certain medications, which include antibiotics, birth control pills, and non-steroidal anti-inflammatory drugs. Patients that eat a lot of foods that are high in fat can also increase their risk. Crohn's disease is associated with multiple different factors, such as genetics, infection, immunology, environment, and diet. Several white blood cells in the intestines are responsible for the immune attack. During the early phase of Crohn's disease, inflammation manifests as fever and physical discomfort. The intestinal trauma causes diarrhea and abdominal pain. The damaged intestine may have problems absorbing nutrients such as vitamins. If vitamin B12 absorption is compromised, the patient may end up with anemia. Anemia may also occur if the patient is losing blood through their stool. The clinical manifestations of Crohn's disease include diarrhea, abdominal pain, weight loss, anemia, fatigue, fever, joint pain, nausea, which can lead to loss of appetite, and skin irritations. Complications that may be associated with Crohn's include intestinal blockages, fistulas, which are passages that form between two internal body regions, infected abscesses, which are filled with pus, tearing in the anus, which may bleed and cause pain and itching, ulcerations, which can develop anywhere in the gastrointestinal tract, malnutrition, and systemic inflammation affecting the joints, eyes, and skin. Shown in the image here is a comparison between normal bowel tissue and inflamed bowel tissue due to Crohn's disease. No cure has been identified for Crohn's disease. The goal of treatment is to reduce the inflammatory response, thus reducing inflammation and avoiding negative outcomes. Treatment for each patient is individualized, as it is dependent on factors such as how severe the disease is and the patient's risk level. For disease that is mild to moderate, the available treatments include steroids and immunomodulators. The goal when using steroids is to treat a flare in hopes of attaining remission while other treatments are started. Steroids should not be used long-term due to the adverse effects they can have. To avoid long-term use of steroids, other drugs, such as immunomodulators, can be used instead. These drugs can take 2 to 3 months to work effectively, so steroids are used in the meantime. For disease that is considered moderate to severe, the available treatments are steroids, immunomodulators, anti-TNF drugs, leukocyte trafficking drugs, IL-12/23 drugs, and JAK inhibitors. Immunomodulators in this case can be combined with anti-TNF drugs for better control of the disease. Anti-TNF drugs are administered as infusions or injections and work by blocking TNF inflammation markers. Patients can begin to feel improvement in symptoms as soon as 2 weeks from starting anti-TNF drugs. These drugs are even safe to take while pregnant. On the other hand, leukocyte trafficking drugs work by preventing the T cells' attack on the gastrointestinal tract. These drugs work more locally than systemically and therefore have less side effects. Then we have IL-12/23 drugs that can be used for patients not responding to other treatments. The effects of these drugs are felt as soon as 2 weeks from the start of treatment. Unlike the anti-TNF drugs, these drugs are not safe for pregnant patients. Finally, we have JAK inhibitor drugs, which inhibit the immune system from responding abnormally. The patient may feel improvement in symptoms as soon as 2 weeks. These drugs increase the risk of shingles and therefore vaccination is recommended. These drugs should not be used on patients that are pregnant. As nurses, one of the greatest gifts we can offer patients is the power of knowledge, because when we share what we know, we help patients take control of their health and their future. A nursing article in the Open Journal of Nursing explains how educating a patient who has been diagnosed with Crohn's disease about the disease will impact how they are able to care for themselves. It is important that the patients know how they can reduce their risk as well as symptoms they should report. Education will also include medication regimens as well as importance of compliance. Nurses should monitor bowel movements whenever possible, paying attention to how often the patient has a bowel movement, as well as evaluating stool characteristics. The nurse should encourage the patient to eat the recommended foods to decrease further inflammation. Independence should be encouraged to improve quality of life.